Bangladesh has entered a strict lockdown in an effort to curb a record surge in coronavirus cases as hospitals across the country are overwhelmed by the virus. Police officers and soldiers are now patrolling the streets, enforcing restrictions on movement across the country. For more, the regional director of the Asia Centre think tank, James Gomez, joins us now from Bangkok. And James, more than 160 million residents ordered to stay at home. How much of a challenge will this be for authorities to enforce?
Well, I think what we are seeing is first day, empty streets. We have to be reminded that this lockdown is only for 7 days, and therefore it remains to be seen over this week, whether the army, the border guards can actually, keep people away from the streets. We have to first go back to understand, why this sudden escalation of infections occurred. Yeah, it came because of the Indian Delta variant, seeping through the borders of Bangladesh. Even though there was strong border control, people continued to move over, and they brought some of the, infections away from the border areas into the heart of the city. And because of this, Bangladesh is having a challenge right now.
And we know that the cities are densely populated. How difficult will it be for residents to comply? What exceptions are there for leaving home?
Well, essentially, health workers, those who are providing health support, they can move, and also for essential services. For this week, it's all around the curfew times. So most people just about a couple of hours ago were all rushing out to get their supplies before the curfew sets in. And this is only the first day. We will have to see how it pans out over the week. But the more important question is 1 week enough to really bring down the infections? I don't think so. Looking at examples from other parts of the region, in places like Bangkok and elsewhere, the many weeks of lockdown have still not seen any drop in infections. In fact, things have gotten worse.
I'm guessing that authorities will reassess as you approach the end of the 7-day lockdown. But the announcement of it has sparked an exodus of migrant workers. How has that added to the challenges in dealing with the outbreaks in Bangladesh?
Well, I mean, it's really very sad because most of the migrant workers came into the city. They are in the informal sector. In the last months and weeks, we have seen especially women and girls who work as domestic help. Almost 85% of all domestic help in Bangladesh, Dhaka in particular, are women and young girls. Since the start of the crisis, the affluent families that hired them have asked them not to come to work. So they have been, living on very little savings and now borrowing money. And they have left, many of them have left the coastal delta, which is an area of climate change impact with eroding land, and many have lost their homes. They have, come to Dhaka and some of the other cities to look for work. Now that work has dried up, they will have to go back because they can no longer pay rent, and there's only so much money they can borrow also from their poor relatives. So it's going to be a challenge when, the climate change affected vulnerable communities head back away from Dhaka back to their hometowns.
And James, what support is there for other vulnerable groups such as garment workers and also refugees living in camps?
Yeah, I mean, this is where we see the unequal, approach to supporting businesses. The large garment factories, still have workers coming in because they supply it to the big brand names. We wonder at this stage, when many people work from home all over the world, whether, garment workers should be exposed to that kind of risk, continuing to work in close proximity. But if we move further to the other group of vulnerable community, especially the Rohingya refugees in Cox's Bazar, they have not had vaccines because Bangladesh itself, had its vaccines delivery interrupted for a variety of reasons. One from India because it held back the vaccines for its own use. The refugees in Cox's Bazar and elsewhere also in the region live in very dense conditions. you see numbers, being reported out of 900,000 refugees, just on 2,000 infections. It's really quite hard to believe given, infection rates surge everywhere. So until the vaccination, scheduled for the community there, I think the risks are much, much higher. 85% of the world's, refugee population lives in underdeveloped countries and countries that are currently very, very low in their vaccination rates.
James Gomez, thanks for talking to us tonight. Really good to talk.
Thank you.